Hi, I'm Dr. Kathy Biery. Yeah, my dental background as a child was really rather unique. We grew up right outside of Detroit, so times were hard back in the late 60s and 70s for the Motor City. We lived in a nice small community, so my parents would just tell me to walk down to the dentist. Well, it was a big old guy in the old green thing, and he was real gruff and he smoked, and it was just a miserable experience. Um, we had significant financial concerns at that time, and I needed braces and all this other mess, like kids often do. So, about an hour away from where we lived was the University of Michigan in Ann Arbor, and they had a big dental school. So, if you were able to go there and they accepted you, you got dental completed at a reduced cost. You had to go all the time because they were students. You were kind of their guinea pigs. But I had so much fun going to the school, and it was such a great thing for our family to be able to get all of that done as well. But I loved the students and I loved the atmosphere, and I really liked going there. And I had teeth removed, I had teeth filled, I had my braces done. So that was a great experience when my younger experience wasn't so good with a big old gruff dentist. So I kind of decided early on that I wanted to go into dentistry so that it was fun. I had a great experience with those students and the dentist there, and it didn't have to be tight collared and strict and stern and just very sterile. I want people, if they dentistry is uncomfortable anyway, so if they can come into a more home-like atmosphere, if we can have a little bit of fun, and if we can take away the edge of the fear and the pain, then it's a better day for everybody, and it makes it enjoyable to come to work, and it's a lot of fun to help people through that kind of stuff. Well, with Mountain View Dental Team, my husband is an oral surgeon and a pediatric dentist, and when I went through dental school, I wanted to do whatever I could to take away the edge and the fear that people had. I want dentistry to be a little bit more user friendly, so to speak. So I went into anesthesia. So when we hooked up together, we were able to do things for children and special needs patients and people that could not cooperate or didn't cooperate. With my anesthesia and my dental background, and then his pediatric background and his oral surgery background, we were able to do pretty much whatever the patient needed, and caused a lot of fear and caused a lot of pain because we were able to put them to sleep. So that was a really nice thing to do. As we progressed, from taking care of the children's dental needs and their fears, and taking care of the special people and their fears, and then taking care of people and their surgical needs, well, then people wanted to have dentistry done, under anesthesia. Just the normal person walking down the street has a big issue coming into the dental office, and so we expanded our facility by adding other dentists that could treat anybody that pretty much walks through the door, and if they need my help, I can sedate them or put them all the way to sleep if they need to. So they can get it done awake, they can get it done asleep, but they can get it done. I would like to be able to make it more accessible to people. I don't want them to be afraid of either the time or the fear and the pain. Um, Especially in this day and age, in this economy, you can't take off 4, 5, 6 visits to go to the dentist. So it's very important to me and to the other dentists that work here. If you can come and sit down and be in the chair 2 or 3 hours, and that's what it takes to get your work done, and you're comfortable doing that, then that's the way that we schedule. It's kind of the one team at one time approach. People can't take off work, but they need to get their dental work done. So, we try to do that. We also have Saturday hours, which helps a lot of people. We do a lot of surgery on Saturdays, so they don't have to take off work. And when you have surgery done and you get put to sleep, you need to have somebody with you. So then that's two people out of work. So Saturdays really help people. They can get it done on Saturday. They can recuperate on Sunday and not miss quite near as much work. Well, the great part about the team is that it's my husband and I first and foremost. And we've been doing this over, well, almost 30 years now. He's a pediatric dentist and an oral surgeon. He's a great specialist, and we love working together, and that works really well with my anesthesia background. I love taking care of the children. I've always been really big with taking care of kids, and I just love doing it. And then when they need it, I have the anesthesia to help them. I will not hold down a child or a special needs patient or an adult patient. I don't own a papoose board. I don't believe in it. If you're not happy in my chair, I can put you to sleep. So that's kind of where we go with that. Dr. Shackman is a board certified periodontist. Right now he's on leave, probably just for a couple more months. He's teaching in his home country of Jordan in the dental school. A very valuable person. He's a great teacher. He's a great periodontist. He's a great dentist. He's been here 2 years now, and we thoroughly enjoy having him. Dr. Eftikari is one of our newer dentists. He's been here about 3 or 4 months now. He speaks Farsi, which is also nice. Dr. Shackman speaks Arabic as well. Dr. Eftikari comes from a long family history of physicians, specialists, and he's a great addition to our team. His fiance, Dr. Rodriguez, is from Colombia, so she speaks Spanish, which is really very, very useful in this area. I have a nurse anesthetist, which is a person that specializes in anesthesia. They deliver a lot of hospital anesthesia around the state and around the country. She's been doing anesthesia for over 30 years, and she is absolutely brilliant. She has a great bedside manner, and she's excellent with the kids. So we always have several anesthesia providers here whenever we're doing sedations on the young and the old. I have a hygienist that's been doing it about 20 or 30 years as well, and we sound really old when we start telling all this. And she's been all over the country, and she's been with us 5-6 years now. She's a great addition. That's Annette. On our staff, I have a lot of my assistants are EMTs, emergency medical techs. They're also certified anesthesia assistants, and they're working on getting some more certification for anesthesia and for dental assisting. I have one of our guys is from Colombia. He's been here about 4 or 5 years. Yana's our Russian-Ukrainian interpreter. She's from the Ukraine. Violetta's from Russia, and she's also one of our Russian interpreters. So we have a whole host, a worldwide people in our office. So try to accommodate a lot of different nationalities, and we enjoy the mixing of all of the cultures, and it's a lot of fun. And we want to help you. That's what we're here for. We want to sit down. We want to talk. We want to do whatever we can to help you. If it's doing a dental procedure that day, fine. If you're having a bad day or you need help with going to another doctor or doing something else, and then we do that too. It's not about coming in at 9 o'clock and having your appointment and nobody talks to you and then you leave. We care, and we want to be part of the community, and we want to be part of our patients' lives, and we want them to be part of ours, and that's kind of how we operate here.